Hello.
So if you don't know Kate, this is Kate McLean, and Kate was pretty much the founding director of the agency way back when. So I thought it might be kind of fun to do a little bit of an interview with Kate, find out some of the secrets from the good old days. When I came to Interface, she was really helpful about pointing out where the bodies were buried. So that was really helpful. So if I first met you and you thought, wow, that Erik, he really knows, how to talk to me, it's because Kate gave me some good advice, really. So we're going to do a little what we call a walk down memory lane with Kate McLean. So I have been looking forward to this for a while, Kate.
I did have 2 glasses of wine.
All the better, all the better. So yeah, I've been really looking forward to this, and Kate's heard me say several times that I feel a special responsibility to you. Taking on the agency reins after you built such a wonderful agency, and mostly I just don't want to screw it up, but more than that, just to really honor what you've done. So Kate, folks know Kate for 4 decades of philanthropic nonprofit leadership. Co-founded Interface in '73, served as the executive director for 18 years. So that in like dog years. Executive director, 18, that's like 30 years in real time. Was board member, and we're pleased to have her on our Leadership Advisory Council currently. BCCF's first president, CEO for 13 years, many boards and awards. I'm not going to ask you how to do it because I don't want to catch it.
That's actually a good thing.
Yeah, so no, just delighted to talk together. So thinking about 40 years, what comes to mind? What's special to you when you think about Interface 40 years later?
I'm really old. 40 years ago. That's a long time. 40 years ago, Interface was above Smiley's Bar. And we had to stop our counseling at 8 o'clock in the evening because the band would start and the building would shake. So you had to be very focused in your therapy 40 years ago. And I would also say that 40 years ago, Ventura County was a totally different county. There was only about 350,000 people in the county. Today there's 850,000. There are only about 30 nonprofits. Today there's about 500. The landscape was totally different. So a lot has changed.
So what are you most proud of, would you say, now looking back on the years, things you started, maybe things you were thinking about? What are you most proud of?
I'm actually most proud that Interface, almost its entire career, has been a leader, a community leader, an organization that brought people together to decide what were the programs that were needed the most. So it wasn't ivory towered with somebody sitting up here saying, this is what this community needs, and pushing it on them. It was bringing people together to say what is needed and how can we work together to make it happen. And the culture of Interface was so important, and I'm just really thrilled, and thank you to you, Erik, for bringing that culture back, because it's so important.
Well, it's great to hear you say that, because we think about that all the time.
I know you
and
do.
there are different ways in which we continue to try to do that, different communities on different issues. So that's neat to hear that was very much part of the thinking from the very beginning, because that does stay a real clear focus for us. So.
Now, one thing you didn't ask me in the beginning was what Interface's first name was.
Can't point your finger at me.
Sorry.
No.
What Interface's first? I know. I always tell my husband not to point his finger at me, and now I'm doing it to you. But what Interface's first name was?
Yes. What was Interface's first name?
The Southeastern Ventura County Prototypical Drug Abuse Project.
Wow. So you think Interface is a weird name? We've definitely gone uphill. Yeah.
It was a mouthful.
Yeah, that's right. Yeah. So and the Interface name really, even despite some of the wanderings that we did in terms of the way we marketed Interface over the years, that Interface brand is strong. People know the agency across the county. Don't always know what we do, but know that name. So.
Well, Interface, I mean, now everybody has the concept of Interface being a computer term where things interact with each other. But in 1973, most people didn't have computers. They didn't really know what computers were. So it was really a very unusual term to use at that time.
Yeah.
But it was based on the culture of what we wanted to do, which was interacting with everybody and bringing people together.
Yeah. So now, thinking about running an agency in the 70s must have been a really interesting experience. So maybe you have some stories of what it was like to actually manage social service types in the 70s.
Well, yes.
She looks over at Mike and Judy, who were actually here on staff in the 70s.
They're going to be my lie testers. I mean, so I can't exaggerate and tell anything. They're going to hold up their hand and say, no, that's not true. But
they won't remember. That's okay. Go ahead.
Well, that was pretty much the 70s, though, too. But I mean, I'm looking around the room, and there are a lot of you who didn't experience the 70s. But the good part of the 70s was it was a time of experimentation, and it was a time where we all wanted to try something new because we wanted to make a difference. And there were some challenges to it, and I don't know if Erik wants me to tell this particular story, but I learned how to build human HR departments from my early years at Interface. So one day I got a call from one of our volunteers who said to me, Kate, I don't know if you know it, but the intake person on duty last night was sitting there on the phone smoking pot. And I said, oh my goodness, who would do that, you know? And so they told me who, and I went to that person and I said, is this true? Were you smoking pot while you were taking the crisis calls? And she said, well, yeah. And I said, well, you can't do that. And she goes, oh, okay, nobody ever told me I couldn't, so all right, I won't smoke pot while I'm taking the calls.
Seems reasonable.
Seems reasonable. So I thought, okay, that problem is solved. About 4 weeks later, I get a call from the same volunteer saying to me, Kate, I thought you talked to X. She was out on the balcony smoking pot. And so I went back to her, I said, is this true? Were you smoking pot on the balcony? And she said, well, I was on my break. You told me not to smoke on duty, but you didn't say anything about my break. So that's how I learned how to make HR personnel policies.
And
they went on from that, trust me.
I'm sure they did. And you said that there were some challenges with the dress code as well for some of the ladies.
Yes, again, this was the 70s, and ladies who are of that age might remember this was the bra burning years. And we had one young woman who was quite heavily endowed, and she always wore her blouses tied here and overlapped. And I happened to be in the office one evening when she was getting ready to go out to do crisis counseling. And I looked at her and I said, oh my
sound like
goodness.
A crisis already.
I said, oh my goodness, you're not going to dress like that. And she said, well, I always dress like that and I've never had any bad comments. And I said, you're there to resolve the crisis between the husband and wife, not create a crisis between the husband and wife. So we had to start developing dress codes.
Yes, right.
And then I was talking to Dorcas and Dottie earlier about how we had a group called the the Delinquency Prevention Commission, Juvenile Justice Delinquency Prevention Commission, and they would come out to visit us. And one of the leaders was Elizabeth Blanchard, who has told me many, many times that she remembers walking towards the door and hearing me yell, quick, put your shoes on!
So from some very informal days back in the hippie era, but still doing tremendous work, and some of the same challenges with families, frankly,
Yes.
right? Troubles at home, arguing with the teenagers, and domestic violence, and Interface started some pretty substantial programs that continue to this day, like domestic violence programs and mental health services.
Well, and again, I would say that that's one of the things that I'm proudest of, is that Interface, even back in the 70s, was considered both a state and a national leader, and we got a lot of recognition for thinking outside the box. We were, to my knowledge, the first organization that had a batterers program, and I remember we looked around the country to find some models of what works with batterers, because we had started, I think we were the second or the third battered women's shelter in the state. I think it was the second. But nobody was doing anything with the batters.
Yeah.
And our whole premise was to try to keep families together as much as possible, and if they did have to break apart, that they still then were able to be good parents to their children.
Yeah.
And so we worked really hard at that goal. And when we looked around the country to find who were batterers, what was working with batters, the only thing I found was a PhD thesis out of the University of Chicago. And from that, we built the first batterers program that became a model around the country.
And that really was quite groundbreaking. Even today, some domestic violence providers are very uncomfortable